Hello, everyone. I'm Kristen Shamanik, a respiratory therapist and educator here at the COPD Foundation. And today we're going to be discussing some of the educational materials and patient resources that we have here at the Foundation. Our theme for this particular collection of materials is inspiring hope and empowerment. We really want to empower people with COPD to manage their disease and really give them a hopeful outlook on their disease process. So here's a little bit about us and what we offer. The COPD Foundation offers a wide variety of patient education materials for every type of learner. So we have something for everyone here. There are booklets and flyers, guides on specific topics that have to do with COPD. So you'll see here second to the right in this picture, the Understanding COPD booklet. That is one of 9 booklets that covers 9 different topics on COPD management. We also have a smartphone app for those who like to be tech savvy and have information right at their fingertips. And we also offer videos. So there's something for everyone here. If you're more of an auditory learner and you like to really hear things or even watch videos, that's where our videos come in. If you're interested more in reading, of course, we have our booklets. So there's really something for everyone here. And many of these materials have been translated into Spanish. So that is great for our Spanish-speaking population. And these materials were designed with health literacy in mind. And what that means is that we want to make sure we're capturing everyone. Some of us are more comfortable navigating that the medical world than others are. And we want to make sure that these are written at low reading levels so that everybody can benefit from them. You're not going to see a lot of heavy medical jargon and medical terminology. This is really going to be more of a patient and individual-centered selection of materials. And there's also image-heavy content for those of us who like lots of pictures and graphs and things like that. So where are you going to find our tools? When you go to our website, which is at www.copdfoundation.org, you can click Learn More, which is what you see right here, the first orange arrow, and you're going to move down to where the second orange arrow is, where it says Downloads Library. When you click on that, you will be brought to this page. And here you're going to see all of the different educational materials we offer that are in print. So these are all our print materials, booklets and flyers and things like that. So the first item we're going to look at is our Guides for Better Living series. This is that series of booklets I told you about earlier that covers 9 different COPD related topics. This is more of a targeted approach. So if you are a healthcare provider or if you work in a clinic, this might be something you'd like to give to your patients when they have certain topics they need covered. So for example, if someone is going through a different time in their life, maybe there's some changes going on, they might benefit from the Coping with COPD booklet, or maybe they're having more flare-ups than normal. They might benefit from the Exacerbations booklet. So there's really something for everyone here. And if you are an individual with COPD, you might find this to be helpful too, because as things change with your condition, you might realize that you have questions about a specific topic and not necessarily needing a lot of education. You just need information on 1 or 2 topics. And this is where I would steer you. So the topics that are covered here are advanced directives. Those are things like living wills and making your end-of-life wishes known. We have Coping with COPD, which covers a mental health aspect of your care, which is very important because we found that the mental health aspect and coping skills really are the missing piece of the COPD management puzzle. So this one's a very important booklet. We also have our Exacerbations booklet, which talks about different types of flare-ups and how to recognize them and treat them right away. We have Traveling with COPD, Oxygen Therapy, which this would be very helpful for patients either who are newly diagnosed and are first starting with oxygen therapy, or it could be helpful for those of us who have oxygen and maybe it's not meeting our needs. Maybe that oxygen delivery system isn't quite what we need or what is working for us right now. So this would give you some options that you could talk with your healthcare provider about. We also talk about exercise in COPD. This is very helpful for those of us who have just started with pulmonary rehab, or maybe we're thinking about pulmonary rehab, or maybe we just want to do a little more exercise and stay active and enjoy those activities that we normally do. And that would be the booklet for you. Then we can look down further. We've got nutrition in COPD. Healthy eating is important for everyone, but especially with COPD. And then we also have hospital to home in case you have an overnight hospital stay. This kind of explains what you can expect in the hospital and what you can expect as you transition back to your home. And then we have understanding COPD, which is sort of an overview of all that COPD is. So these booklets, again, would be useful for patients, but of course, they would be also helpful for the inpatient population, clinics, rehabs. There's many different options here. Here's an inside look at the Guides for Better Living series. So these are a few spreads from inside of the booklets. You'll notice here it's a magazine layout. So this is not like any educational material you've probably seen before. Many of the ones I used when I was in the hospital were very kind of boring. They were black and white pictures, some were cartoons, and we really wanted to make sure we were using realistic pictures here, pictures of real people in real situations. So for example, you'll see that we have a lot of diversity here. You'll see that we have people with different backgrounds, different ethnicities, and different abilities. So for example, we have an individual there who's using a wheelchair. And you'll see that throughout all of our educational materials. We are very serious about making sure that we are covering diversity and really offering something for everyone here. We want everybody to look at these materials and see themselves reflected in the imagery and in the text. You'll also notice that these have interactive sections. Many of these books, almost all of them in fact, have an interactive section. So for example, you'll see this one here, directly below the man who's holding his chest. You'll see it says to stop smoking, make a plan. And here the person with COPD will read through it and answer the questions. So for example, the first one is set a date to quit. What date have you chosen? You might write in a date that's your sort of target date for when you want to get started. The second one is remove all cigarettes from your home. What other places might expose you to cigarettes? So this is really starting the conversation with yourself and looking inward and thinking, well, how do I make this plan to stop smoking? What are some things I maybe want to ask my healthcare provider about, or maybe I want to talk to my family about? This is just a way to keep yourself organized and to really think about what you're looking for and your goals that you want to set for yourself. And all of these materials, not just the Guides for Better Living series, but all of our educational materials have current content. They're up to date. We update them frequently. And we also have experts that review these materials. So every piece of material goes through an expert review with at least 2 medical experts. So these, you can feel confident that they are up to date and well thought out. Here's another inside look at the guide series, and you'll see here that our main focus is vibrance, images of hope, lots of color, and you'll see that realistic portion I was talking about earlier, where we want to have pictures of real people, real foods, real flowers, real airplanes. This is what we're looking for. We really don't want to have those same old boring education materials. We want something different. So you'll see here also that we maintain consistency between each guide. So what we mean by that is, although the images are different, they are tied together. For example, on the left, you see this really interesting image of lungs made out of flowers. You'll see a different image of lungs on the table of contents page in each one of the guides. So I would actually encourage you to take a peek at them because they are really a lot of fun. And they all focus on patient empowerment. That really is our theme. So the basics of COPD booklet, this is another one of our materials. And this one is, again, bold, vibrant imagery. You're going to see that across the board with all of our materials. And it's designed with the newly diagnosed patient in mind. So anyone really could benefit from reading this booklet. It really covers all major topics that are related to COPD, but in more of a abbreviated version. So you're not going to have an in-depth discussion about each topic. It's kind of a broad overview. But again, it'll get that conversation started. It'll help you to understand what parts you might have more questions about, and you can talk with your provider about that. It's also been translated into Spanish, which is great for our Spanish population. And it discusses topics such as medications, testing, which is the spread you see here in the middle, exercise, oxygen use, and much, much more. There is a lot in this small booklet. And this would be best used by, again, the newly diagnosed patient or individuals with COPD just might to read through it and see if there's something new that maybe they didn't know before, or maybe they have questions and they want to see if this booklet answers it for them. It would also be very, very useful, especially in the doctor's office for that newly diagnosed patient. You may also find this in inpatient settings where patients are newly diagnosed with COPD. This is our disaster preparedness plan. Now, this is a very comprehensive program that covers everything there is to know about preparing yourself for an emergency. Now, depending on where you live, you might think, well, I don't really have that many, tornadoes or hurricanes or whatever it might be. But if you think about it, even a power outage is an emergency, especially for someone with COPD who perhaps uses oxygen at home or other medical equipment at home, and now they've lost their power source. So these pieces of information here really help you to sort of think about what could be happening in the future and then plan for it. So this is a booklet with a tear out section in the center that has a variety of forms and lists and interactive documents for you to work with. So for example, here's 2 examples on our right side of our screen. The disaster plan chart, which is on the far right, is a chart where you would think about the possible disasters in your area. So where I live, we get tornadoes and blizzards and power outages and things like that. So I would think about those things. But if you lived elsewhere in the country, you might have flash floods or wildfires or any number of emergencies. So you would actually write down what the disaster could be, what might happen, how you can prepare right now for it, and then what you should do if it actually happens. So this gives you an idea of what to do. You're not left in the dark when an emergency happens. You have a plan in place, you know what to do, and everybody can feel a little bit more confident that way. Another item in our center tear out section is the Go Kit list. There's 2 lists. There's the Go Kit and the Stay Kit. The Go Kit is a list of information and items that you would actually put aside and put in a bag and keep to the side, and you would take that with you if there's an emergency and you have to leave your home. So it would include things like water bottles and non-perishable food and medications and things like that, things, essentials that you would need to take with you. There's also a Stay Kit list. The Stay Kit list is going to have things that you would need if you're going to stay in your home during an emergency. And it would have similar items as the Go Kit list, like food and batteries and things of that nature. But you can see here there's also room to add your own, because of course everybody has their own necessities that they would want to take with them. This is also available in our COPD Pocket Consultant Guide app, which is available in the Apple App Store and Google Play. And what's nice about that is you'll have that information at your fingertips. So instead of having a hard copy that you have to, carry around or store at home, you would have it right there in your phone. So you can do it one of 2 ways. This is our Impact of Smoking flyer. This is one of our items that has a smoking cessation message. So our message here is, it's never too late to take a different path. So in other words, if you quit smoking today, you will slow the progression of your COPD, and it's never too late to do that. Anytime you quit, you are slowing the progression of your COPD, and your health benefits start right away. This one has I think it has a very impactful message, a very important message. And that is, while it's not always easy to quit, it's worth it. And so are you. And I think sometimes we lose sight of the fact that these big changes that are difficult, you are worth it. You can do it, and we're here for you. And this is one of the tools that they could use to kind of get started on smoking cessation. So for example, when you turn the page over, this is a double-sided flyer. So the front is it's never too late to change your path. On the back, it's never too late to quit smoking, and it explains why. So at the top, we have our recipe card, which gives you your recipe for success. This is a basic outline of the things you're going to need to do in order to become a non-smoker, hopefully. And we know that it's not always easy. It takes multiple tries sometimes, and one size doesn't fit all. So that's where the toolbox comes in, halfway down the page. Here we're talking about the different tools that are available for you from your healthcare provider. So those things might be gums and patches, hypnosis or therapy, many different choices. And sometimes it's a combination of a few choices. It's not always one item that gets you over the hump and makes you successful in quitting smoking. And then at the bottom of the page, that's a graph that has a lot of information on it. The basic idea here is just what we said earlier, which is the sooner you quit smoking, the more you slow the progression of your COPD. And that at any age, it's important to quit smoking. And I think a lot of us sometimes think, well, I've smoked for 40 or 50 years, why stop now? But the fact of the matter is, it will help. Even if you have smoked for 40 or 50 years, stopping today does make a difference. And this item has also been translated into Spanish, which of course is very helpful for our Spanish speakers. And this can be used not only by people with COPD, maybe it's something they want to kind of print out and keep with them so that they have a tool to refer to in case they're interested in quitting smoking. But it can also be used by healthcare providers in pulmonary rehab, in inpatient situations. I could imagine this being distributed as part of your discharge instructions after a hospitalization, or for outpatient smoking curriculum. It could certainly be used there too. This one is one of our most important educational materials. This is the My COPD Action Plan, and every person who has COPD really should have this document. It doesn't have to be this exact one. Of course, we'd love it if you chose ours, but we want to make sure you have a plan in place for good days, bad days, and really bad days. So here we have our traffic light idea. Green means, of course, good, just like the traffic light. You're doing well, everything is normal, you're just going to take your medications as prescribed, no big deal. On the yellow days, that's when changes are happening. So either you're starting with an exacerbation or flare up, maybe you're getting a little bit sick, maybe you overdid it and you're just a little short of breath. Something's going on here that requires action. And on the red days, that's an emergency. That's when you need to seek care immediately. So this piece of paper you're going to take with you to your physician's appointment or to your pulmonary rehab or wherever you may be going, and you're going to fill that out with your healthcare provider. You're going to sit down together and make a plan. And then the best thing to do with this is either to tack it up on your fridge or keep it by your bedside or wherever you're going to see it and use it the most. That's where you want to keep it. On the back side, you'll notice we have tips for living well with COPD. And what this one has is just some general tips for how to better control your COPD, although we can't always control it, but how to better treat it and prevent those flare-ups. So for example, we have health and safety tips, we have tools and techniques, we have more resources listed. So if you're interested in learning more about any particular topic, we can refer you out so that you know where to look for that information. But some of the items here on the list would be things like eating a well-balanced diet or getting your vaccinations and avoiding people who are sick. All those things that are important for not only your overall health, but your health when it comes to your COPD. And this, of course, is an easy to understand format. As you can see, it's very clear, not a lot of jumbled mess or a lot of bright colors. It's very easy to write on and it's easy to understand. And it also has been translated into Spanish. So this really should be something that you have filled out with your healthcare provider. So you might have received one of these at your healthcare provider's office. This is often used in healthcare providers' offices. Sometimes it's used in inpatient settings. You might have a copy from your respiratory therapist if you're in the hospital as an inpatient, or you might receive this as part of your pulmonary rehab program. So there's many different uses for this one. This one is our Staying Healthy and Avoiding Pneumonia flyer. Now this one, I have to say, is very interesting. It's a little bit different than our other educational materials in the sense that it is a little bolder in its imagery and colors, a little more eye-catching, I would say. And this one we took a male perspective, and it certainly doesn't leave out the ladies either. We have a lady pictured on the back side, but on the front side, we wanted to focus on the men for a moment because we all know just in general that it seems that some men are more hesitant to go to the doctor than others. Now, some of course will, but others will sort of wait until they're really sick before they go in and see the doctor. And we wanted to turn that around. So to solve that problem, we really focused on the men on this front side of this double-sided flyer. And one of the studies we cited on this front side showed that some types of pneumonia are actually more severe in men than women. So they really have to be good detectives in seeing what their symptoms are and am I going in the wrong direction. So this flyer really encourages you to sort of look inward, focus on yourself, see how you're feeling, and at the first sign of a problem, go ahead and see your physician. So some things that covers on the back side, which is really where the bulk of the information is what is pneumonia? What causes it? What are the symptoms and how can I avoid it? How can I avoid this problem? And we also, of course, like all of our educational materials, we have more resources available for you. And that way, if you have more questions or you need a little more information, you know where to go to get reputable information. It focuses mainly on the prevention of pneumonia, and also we offer tips for recognizing those flare-ups that might be coming. Sometimes those flare-ups are very subtle, and those subtle changes you might not notice. So this is one of those flyers that's really important. I could imagine this being used not only for your personal use, but you may receive a copy of this in your doctor's office if they think you're developing pneumonia, or maybe after you've had pneumonia in the hospital and you had an overnight stay, maybe the staff would give you this flyer there. So you may see it in a variety of places. We also offer an educational video series. Now, where you can find those is similar to where the downloads library is. So we'll go through this one more time. So you go to www.copdfoundation.org. Then you're going to click Learn More, once again, like we did before. And down here on the second orange arrow, you're going to see the educational video series. Now, when you click that, you're going to be taken to this page. You can see here, this is our video series. This covers a lot of information, and it's especially helpful for our learners who really like to sort of see things in action. It's one thing to tell you how to use your inhaler, it's another thing to show you. So this is a nice option because if you have a question about your inhaler, or maybe you have a brand new inhaler that you've never used before, you can actually follow along to the video and pause it if you need to. You can stop it and follow along, get your inhaler ready, and then continue on. So this is a really nice resource for patients. And also in our video series, here are a few examples here on the right side of just some still images from the videos. The first one shows how you clean your nebulizer. Another one shows the Ellipta inhaler. And the last one shows one of our nebulizers. Now there's many, many types of nebulizers, which of course we know, and there's many, many types of inhalers. And this video series really is a good cross-section of those different types of inhalers. So chances are, if you have an inhaler that you're not sure how to use, we probably have a video to help you with that. So the first section is the inhaler education. These are going to include things like using your MDI with a spacer. Hopefully we all have spacers. If we don't, talk to your healthcare provider and see if you need one. They are helpful. It's also called a holding chamber. So you might have heard of one of those. It's kind of an extension piece that helps to hold that puff of medication so that you breathe it in a little bit slower. We also have a DPI technique, which is dry powder inhalers. And those, of course, are used in a completely different way than your MDIs. So it's important to know what kind of inhaler you have and then the proper way to use it. We also talk about breath actuated inhalers, which are those inhalers where it doesn't actually shoot anything out at you. It doesn't spray anything at you. You have to trigger that inhalation. And you can find videos about that. We also have our nebulizer education videos, which include everything from breath-actuated nebulizers to jet nebulizers and mesh nebulizers, just lots and lots of nebulizers. And we're also discussing storing and cleaning your equipment, because it's one thing to use your nebulizer and it's another thing to store it correctly and clean it properly, because we don't want to, infect ourselves or have dirty equipment, especially when we already have COPD. We don't want to cause any more problems for ourselves. So these are all really important videos, and I would encourage everyone to take a look at them. And there's more than just this. This is just a small sample of what we have to offer. We also have something called the COPD assessment test, or CAT, we call it. So the CAT measures the impact of COPD on your daily life. So in other words, we want to see how much the COPD is affecting your life, your daily life, and your daily activity. You'll find this in our COPD Foundation's COPD Pocket Consultant Guide app, which, as we mentioned before, is free to use, and it's available at the App Store for Apple or Google Play. And it's also available for purchase as a hard copy, a tri-fold brochure on the COPD Foundation's online catalog. And these are completely free. All you pay is shipping, which is really nice. Sometimes it's nice to have a hard copy of something, just in case for some reason your phone isn't working or your app, isn't working properly on that day. But if you do use the one in the app, it's going to look like the picture here on the left side. And what you have here is some examples of questions. So the first one is, I never cough, or I cough all the time. You're going to look at that range of numbers and choose where you feel you fall. And then the same thing for the next one. I have no mucus. I have a lot of mucus. Where are you on that spectrum? And then it'll give you a score, and you can see sort of how well your COPD is doing at that moment. And maybe there's some changes that need to be made. So this would actually help sort of start that conversation between you and your healthcare provider. We also have, like I mentioned, our COPD Pocket Consultant Guide app. Now, this is available, as we mentioned, for download at the App Store and Google Play. And there's 2 different versions in one app, which is very nice because it's sort of a one-stop shop for both patients and providers. So you'll see on the one side, there's the patient view. You can choose patient or provider. On the patient side, we've got things like activity tracking, your action plan. So you can actually have your action plan at your fingertips on your phone and not have to worry about, carrying it around with you. You've got it right at your fingertips. They also have a tracking calendar and those inhaler videos in case you need those while you're, on the go. We also have a wallet card where you would, similar to using a paper wallet card, you would actually fill out your medication list and your immunization record, and you would have that available with you at all times. And we also have exercise videos, which is another nice bonus, which we do also offer on our website. And on the other side is the provider view. This is for the healthcare providers and healthcare professionals. This includes a little more in-depth information, things like our COPD Foundation journal, inhaler education, the CAT that we talked about earlier, and some other pieces of information here. You'll also find in our app information about the COPD Patient-Powered Research Network, which is a research group for COPD people with COPD, which you might be interested in learning more about. And also COPD 360 Social. Now that is a message board style platform for people with COPD. And what they would do is they would join, and you can actually connect with people just like you who have COPD, and you can learn from each other. And we really designed this to be a safe place for people with COPD to connect with each other. So we don't discuss a lot of politics or anything like that. We have admins who are very careful about filtering out anything that is not appropriate. This really is supposed to be a safe place for all of us to share our story, share our journey, and help each other. And you can find more information about that on our website or, again, in this app. We also have direct access to the COPD Digest, which is a blog that you might be interested in looking at. And of course, there's much more. Each of these sections have subsections, some of them, and there's just a wealth of information here. So this is really a nice tool to have at your fingertips. So where can you find these materials if you want to actually order them? I will tell you that for individuals with COPD, if you're looking for something for your own personal use, you can download copies of these for free for your own personal use. Now, if you're a provider, a healthcare provider or a healthcare professional, or maybe you want more than one copy because you want to take it to a community event or something of that nature, you would want to order it from our online catalog. So here's where you'd find that. You go to our website, and at the top you'll click Learn More, Educational Materials, and then Downloads. And here you'll see at the top right above the Guides for Better Living and all the print materials, that online catalog link, which is the second orange arrow. And that's where you would go to go ahead and order copies for yourself. And if you're interested in going directly to the website, to the catalog website without going through our website, this is the link here on the bottom. That's the direct link. And we also offer a Spanish webpage. So on our main website, if you scroll all the way down, so this is what it looks like here with the Amazon smile, just above that with the orange arrow, you'll see Espanol. If you click on that, you'll be taken to this page. And this is our COPD Foundation Spanish webpage. So as you can see, everything has been translated into Spanish. And this is where you'll find things like our Spanish versions of our educational materials and our Spanish videos all in one place. So this is a really nice sort of one-stop shopping if you're looking for materials in Spanish. And again, if you don't want to navigate through our website to this Spanish version of the website, you can find the link right here at the bottom of the screen. And I just wanted to thank you all for joining me today. I hope that we were able to answer some questions for you and offer you some interesting educational materials. There's really something for everyone here. If you have any questions or if you need any help, you can always contact us through our website. And I hope that we were helpful today. Thank you very much for joining us.